Good afternoon, everyone. As you are just joining us, we're going to give it about 60 seconds and let everyone get into our virtual room here, and we will be underway. We're so glad that you're with us today. Well, hi again, everyone. We will get underway here this afternoon. It's a little after the top of the hour. We are so glad to have you with us for the December edition and a very special edition of the Hunt Institute's Early Efforts webinar series. My name is Dan Worry. I'm the Senior Director of Early Learning at the Institute, which is located in Cary, North Carolina. We are an education policy resource to governors and state lawmakers and other senior state elected leaders around the country. And this is our early childhood series. You see on the screen today a cast of thousands. This is a little different from our traditional web panel as we celebrate 2021's big wins for little kids. It has been an exciting year in the world of early childhood policy. So many amazing innovations. We felt like we needed to change things up a little bit today, try something new and interactive. And so here's how this session is going to work, which is a little different from webinars that you may have attended in the past. You see, we've got a little bit bigger group to get through during our first hour. First thing to know is that we do have this scheduled, this event overall for 2 hours in total. The first hour will follow a traditional webinar format where you are welcome to chat in questions if you have any, but know that the first hour is going to be a little bit less interactive than usual as we give each of our panelists an opportunity to go around to share updates from their states. And then during the second hour, we will actually close this webinar. And so this is where we need careful direction following. So in the chat throughout this hour, my colleagues from the Hunt Institute are going to be dropping in information on the second hour. During the second hour, we're going to break into 4 separate Zoom meeting rooms. So rather than a webinar that is just kind of view only from your perspective as a participant, these meeting rooms in the second hour will give you an opportunity to participate on camera and to have conversation and ask questions directly of our panelists. We're going to break that into 4 rooms that will match up with the kind of umbrella topics that we'll be talking about during the first hour. So do be keeping an eye on the chat because that will give you information on where you will want to go during the second hour. Do keep in mind, we thought maybe as a first try, it'd be easier to go ahead and just set up Zoom meeting rooms rather than do the select a breakout room. If there is a possibility that you might want to pop into more than one of those rooms, please make a point during this first hour to cut and paste those links and know where you'll want to go during the second hour, because this session will be closed at that point as we break into Zoom rooms. One of the reasons that we are hosting this special year-end event relates to our partnership with our good friends at the Alliance for Early Success. And I am so glad to have Helene Stebbins with us here today. The Alliance each year publishes a wonderful 50-state summary that looks at the early childhood policy innovations that have happened in the states over the preceding year. And just yesterday, the 2021 edition of that report was published that includes descriptions of many of the topics that we will highlight throughout the day as big wins for kids. And so, Helene, first off, I just want to thank you for your partnership. We're so glad to have you with us and to be doing this event today in partnership with the Alliance, and wanted to give you a couple minutes to offer some welcome and to share a little bit about the report.
Thank you, Dan. And thanks for inviting us to co-host this webinar with you. We couldn't be more excited to share about what's happening in the state. I meant to give a little bit of time and voice to those people who are working so hard in the field to make that happen. So before we move to that, I just want to give a little bit of an overview about the Alliance and who we are. We are a network of organizations working to improve state policies for young children, birth through age 8. We pool funds from more than a dozen private foundations, and then we re-grant them to allies in all 50 states and 24 national organizations. And our mission is to create a powerful community of allies that informs, accelerates, and amplifies your effectiveness so that every child in every state has what they need in the early years to realize their full potential. And as Dan mentioned, yesterday we released the report about the great things that happened in 2021. There's so much information in there that's going to take way more than an hour to go through all of it. So let me just give you a quick guide on how to find it, where the data comes from, and what it includes. So the first thing is to download the report, you need to go to our homepage. There'll be a link in the chat right now, but in case you need it in the future, and there's a state-by-state drop-down menu at the top of the page. If you click on 50 State Progress Report, you'll get this second screen, which allows you to download the report. So that screen will look a little bit like this. That's what the report cover looks like. And then finally, we also have in that drop-down menu, individual state policy landscapes. So there's a lot of overlap in the content between what's in the report and what's on our state-by-state pages. But they all sort of really focus on the legislation, the policy that passed. The report does have this going forward section that you see on the example here about what our allies are hoping to accomplish in the coming year. So how do we get this data? Well, we surveyed our allies in the spring and summer on policy changes in their states, and all 50 responded. Our primary focus is on legislative and administrative policies with links to bill language and regulations when available. These summaries include playing defense to prevent bad policies, such as West Virginia's defeat of legislation to repeal the state income tax. While we focus on wins and successes, we also recognize that sometimes it takes multiple years for policies to pass, so we highlight sustained advocacy campaigns as well. For example, last year there were 7 laws enacted for paid family and medical leave, but 9 states said they made progress on their campaign. So again, recognizing that this takes multiple years, we also want to capture that in the report. There's a spotlight on federal COVID relief funds. That was sort of big last year, but we tried to keep that separate to disaggregate it from the other policy. And then finally, I want to be really clear that while the data come from Alliance state grantees, the policy wins and what's on these pages were collaborative efforts. We try to capture who that includes in the state web pages with an advocacy landscape that names some of the other players, but we fully recognize that no one group is responsible for what got done there. We're just trying to create a page that you can go to get a really good flavor of what's happening in your state and who the players are trying to make that happen. So I'm going to quickly give you a few takeaways, big picture about what happened. The first was responding to COVID dominated the policy scene, but it did not prevent other policies from passing. Big policies like the Blueprint for Maryland's Future with a vast expansion of public pre-K and schools and childcare programs. This includes new funding for the Infants and Toddlers program and the creation of 135 new full-day, full-year comprehensive early education centers for low-income children birth through age 5, and 30 new family support centers over the next 10 years. This had been in the works for years, and they signed it into legislation last year. Several states also had big, bold, comprehensive childcare legislation passed. You can look at Oregon, New York, Washington, and Vermont. These states then can potentially be models for other states when the Build Back Better bill passes and you're looking for how you can really transform childcare in your state. So I just dropped a link in the chat that has a little more detail on those states. There were also child welfare wins, like a 35% increase to the budget for the Department of Child Abuse and Neglect Prevention in Alabama. And Georgia is learning from Alabama with dedicated revenues and a new task force focused on infant and early childhood mental health. Infants and toddlers can often get overlooked in early childhood policy, but not in 2021. New Jersey established a universal home visiting program and was one of 20 states that extended Medicaid coverage for mothers until 1 year after giving birth. Many states are also investing in doulas to reduce maternal and infant mortality and address racial disparities in health outcomes. You'll hear more about that from Virginia this hour. Our country's racial reckoning continued with 55 laws and 3 executive orders demonstrating policymakers want to understand and address racial disparities. And our speakers from Washington and California will share some examples of what that looks like. And finally, there were 45 laws and 2 executive orders related to the governance of early childhood programs. Now, I firmly believe that there is no ideal governance structure, but multiple funding streams and programs across health, human services, and education agencies do require some coordination. And we've got some examples for you teed up with our speakers from North Dakota and Colorado. So with that, let me get out of the way and pitch it back to Dan and hear from those who are really doing the work in the states.
Elaine, thank you so much. We're so excited and really can't wait to dig in more. I spent some time already with the report a little bit yesterday, and I'm just really looking forward to getting it in my hands physically and digging in even more deeply. So Helene mentioned those who are really doing the work in the states, and that is who is joining us today. We've got a fantastic panel. I'm going to go around quickly and introduce you to our panelists, and then we'll dive right into our conversation. Dr. Stefan Blanford is the Executive Director of the Washington Children's Alliance. Dr. Barbara Cooper is Secretary of Early Childhood Education for the state of Alabama, their Department of Early Childhood Education. Bill Jager, Vice President of the Colorado Children's Campaign. Chris Jones is the Director of the North Dakota Department of Human Services. Ted Lempert is President of Children Now, which is located in California. Georgia Miartin, Director of South Carolina First Steps to School Readiness. Representative Tana Senn is the Chair of the Children, Youth, and Families Committee and the Washington State House of Representatives. And Stephanie Spencer is Founder and Executive Director of Urban Baby Beginnings, which is located in Virginia. And you see several other boxes here on the screen. I will mention just quickly, those are the rest of the Hunt and the Alliance team. They will introduce themselves in the breakout rooms, but we will have staff from both groups who are going to be helping to moderate your questions when we move into hour number 2. So keep an eye again on the chat there. So we're going to start off with childcare. Boy, what an exciting year for childcare. So much coming down the pipe from a federal perspective, but states have really been leading on this topic as well, and really none more so than Washington, where Representative Senn and her colleague, Senator Claire Wilson, were the primary sponsors of what was known as the Fair Start for Kids Act, which really comprehensively addresses a wide variety of issues related to the needs of children and families in the state of Washington. So Representative Senn, I wanted to give you the opportunity to sort of kick us off. Tell us, for those who may not be following the developments there in Washington, talk to us about the Fair Start for Kids Act. What does it do, and what will it accomplish for children and families?
Thanks, Dan. And just want to take a moment on behalf of the rest of the speakers to thank the Hunt Institute and the Alliance for Early Success for having us all today. I am thrilled to share with you the progress of the Fair Start for Kids Act in Washington State. So over the past couple years, especially pre-COVID, obviously, I'd been traveling around the state doing focus groups and visits to family homes and childcare centers and play and learn groups, and really trying to hear directly from our stakeholders and from those in the field and parents what were the issues around childcare. And then COVID came about and really highlighted the needs that we had heard. And it was pretty clear. COVID highlighted healthcare. It highlighted just the importance of childcare 0 through 12, not just 0 through 5. It highlighted businesses as allies because they really needed employees to come back to work. So kind of with that before us, we really had a little bit more of a runway, I think, to move forward on this very comprehensive legislation, the Fair Start for Kids Act. And it was broken down into 3 sections to help families, to help providers, and then to help littler kids. So for families, we were really focusing on making sure that childcare was accessible and affordable. And so for us, that meant dramatically increasing the eligibility of the families. So raising and changing from federal poverty level to state median income. And Washington State has a high cost of living, so FPL was not a realistic measurement. So we moved to SMI and increased eligibility. And then we dramatically lowered copays. We had heard from so many families who were eligible from income, but couldn't afford it because of the copays. And we brought those down to well under $200 for as a max for families. And so that was really critical. Then when we looked at providers, who mainly women of color all across our state, we knew they needed the most support. So we increased subsidy rates, and we're starting to look at a cost of quality model, but we're not there yet. So we got to 85% of the market rate for our subsidies for Working Connections childcare. We made sure that we were subsidizing healthcare premiums, because again, as I mentioned around COVID, that also just became so unimaginable that childcare providers who were open while schools were closed so often didn't have healthcare. So wanted to make sure that they had the benefits that they needed. And then also to recognize and appreciate their skills that they might have. So extra pay if you had experience in trauma, trauma-informed care, or if you were bilingual and teaching bilingual classrooms, wanted to make sure that there was extra pay there. And we created and expanded, created a mental health program too, and consulting for infant and childhood mental health for childcare providers to work with them directly, the kids and their families. And then third was for children overall, if you want to think about it that way. Not every family is going to send their kid to childcare, and so we wanted to make sure that there were play and learn groups for families and for family, friend, and neighbors to go to get some early childhood education and some socialization. We expanded home visiting. We invested significantly in infant care rates in particular, because we knew that that was some of the biggest childcare desert issues across our state. And we created, which I was really excited about, a special education fund. So just like K-12 has that, oftentimes if there is a extra special ed needs, you could apply to a special ed safety net. We created a special ed fund for childcare to make sure that kids with disabilities wouldn't be likely to be left out of childcare just because of their disability. And really overall diversity was at the forefront of what we were thinking about. Again, these tend to be very diverse women of color who are the providers. So we made sure that we were increasing language access. So all of our communications and programs are going to be in Spanish, English, and Somali, because in Washington State, those are the 3 big languages, and then hopefully also extending into Russian. But that was a key component, was to make sure we had that language access. We created equity grants for those programs that are particularly bringing in an ethnic element to their programs, whether it was tribal ECAP or a Vietnamese childcare. As I mentioned, again, funds for bilingual education. And then we made tribal youth eligible categorically for our state preschool program. So there were lots of other components as well in there, but as you can see, I think the beauty of the Fair Start for Kids Act was that we looked at it knowing that we couldn't just pull one lever. We really, to make an entire industry work, we had to make it accessible and affordable for families. We had to make sure that providers could stay in business and that was, profitable and they were able to do that and attract the staff and talent they needed, and that kids and families felt supported no matter their income, their eligibility, their ethnicity. And so those were really at or their age. So that was really at the forefront of the Fair Start for Kids Act. So very excited about the progress being made in Washington State.
Well, Representative Sen, thank you and congratulations. I mean, maybe by way of segueing now to Stefan as an advocate there in Washington State. I mean, Stefan, no question. I mean, as Representative Sen, kind of reeled off all of the different things that this act did, it occurs to me that, in many cases, it would have been a huge accomplishment to do any of those things individually, much less do all of them together at once. So I'm curious to know, sort of, what can you tell us about the process of building consensus around that in Washington, and how do you see the act impacting the children and families that you're working with?
Well, I know that it has had a huge impact and will have a greater impact. I am about a year and a half into my role as the executive director of Children's Alliance. We're a statewide advocacy organization, and many of we coalesce a coalition of providers that provided a lot of input into the drafting of the proposal that Rep. Sen talked about. And when I came into the role, many of the providers were talking to me about how dire the straits were at the time. When I came into the role, we had a $9 billion budget deficit projection going forward. And so, and the implication of that was somewhere around 46% of all providers in the state anticipated that they would close their doors before the end of the year. And so that would have a disproportionate impact on children and families, and particularly BIPOC children and families. So we knew we had to do something pretty significant, and it had to be racially equity focused. And so it is just a wonderful thing that we were able to get to that, provide input to the prime sponsors of the bill and get it through the machinations of the legislature and actually on the ground impacting children and families in the state. The biggest challenge right now is around implementation, making sure that the legislative intent that, inform the legislation actually gets through and impacts children and families. And that's critical work that goes on. But I can tell you, having just come from a conference in Washington, D.C. last week, there are a number of states that are looking at what we did in Washington State around the Fair Start for Kids Act as a model that hopefully other states will be able to implement. And that's just a wonderful thing. It feels really good to have made that change. I actually, Helene, I shared yesterday with my board the report that you were talking about, and noted the fact that Washington State was seen as a leader. And it is very inspiring to get to that place. It's just a matter of implementation now, making sure that it's well implemented.
Stefan, thank you. And just so exciting. Again, congratulations on all of the great things that are happening in Washington. And just as a note for our viewers, as we break into our second hour into the breakout rooms, if you were interested in speaking more with Representative Sen and Dr. Blanford on the child care happenings in Washington State, theirs will be one of the rooms that you can choose to go and ask additional questions and hear a little bit more. There's certainly lots and lots to know about the Fair Start for Kids Act. And I know, a fascinating conversation, particularly in light of all the conversation that is happening around Build Back Better. I think, obviously, Tana, you've set a high bar for Washington State already here as Congress is looking. As we move on, again, this first hour is going to move right along because of the number of panelists that we have. I mentioned Build Back Better and its child care investments. The other obviously substantial early childhood piece of Build Back Better relates to the expansion of pre-kindergarten. And it's interesting to see just here over the past couple of weeks, there have been a number of articles about the kind of partisan divide on Build Back Better, and which states will do what. But definitely bears saying that 2021 was a good year for pre-K expansion, and that a lot of that pre-K expansion was being led in very red states, including Alabama and South Carolina, who are joining us here today. So, Secretary Cooper, let me start with you. First class pre-K in Alabama just marked its 15th year at the top of NIEER's rankings of pre-K programs around the country. And I know under Governor Ivey's leadership this year saw another major expansion. So talk to us a little bit about Alabama's expansion plans for pre-K, and to what do you attribute this amazing run kind of at the top of the quality rankings?
Thank you so much, Dan, for the opportunity to speak with you about Alabama's first class pre-K program. Since 2012, the goal of the Department of Early Childhood, the governor's office, and our legislative leaders and business community has been to achieve full access for all families who want a first class pre-K experience for their children. We did a study and learned that about 70% of our families would actually want access. So we created a plan that has been very intentional under 3 governors' leadership around expanding the first class pre-K program. And we remain true to that program in Alabama to this day. And even in the middle of the pandemic, we still remained focused on pre-K and our early learning efforts, and was able to continue the expansion efforts. We are requesting to continue to move forward and to remain with the plan that we have in place. We know that Build Back Better could bring many opportunities for our state around childcare, but we also recognize that we must have a very intentional plan in order to continue to expand first class pre-K. One of the things that we've learned through the expansion efforts is we have to get the workforce ready. Just because we receive additional funds doesn't mean we'd be able to open X amount of classrooms overnight without having that workforce in place. So we're doing a lot in Alabama around studying our workforce. We have an upcoming summit that's going to be held to allow us to really engage in those types of conversations that will allow us to continue with that expansion. But because without the workforce, we wouldn't be able to continue to have the quality. But we are requesting additional increases for the first class pre-K program in the way of just through our state budget, over $27 million. And of course, this allows us to continue to be on that plan to have full access by 2026. So again, by doing this incrementally, we're able to continue to have that quality. I believe that the success of our program is attributed to having bipartisan support, certainly having Governor Ivey as one of our biggest cheerleaders, and she talked about the pre-K program in all conversations around the importance of having pre-K be the foundation for any economic plan. We've engaged our mayors in Alabama, Hunt Institute. Thank you for that support of that effort, where we brought mayors together to have conversations about how having high quality pre-K absolutely supports a city and can be their economic plan for the future. So having those boots on the ground engaged has really been a big contributor to us being able to continue to be successful with the program. We also have a major focus on continuous quality improvement. We monitor everything we do within the department, and we are accountable for all funds that we receive to ensure that children who actually participate in our programs continue to outperform their peers in reading and math, continue to have all of those other markers for success, such as great attendance, as well as less likely to need special ed, and as well as behavioral referrals as they continue to progress. So we have data that demonstrates that children who participate in our program continue to have this success through the middle school years. And I contribute that and attribute it to a large part of the success that we have achieved in Alabama. We also are very focused on the workforce, and we recognize that infant early childhood mental health and mindfulness type activities and really focusing on mental health in the workforce has been extremely important as we continue to do this work and talk about expansion efforts throughout the pandemic. So as we continue to move forward, we will remain true to the plan that was established in the early 2000s for Alabama around expansion, because we know that this plan has been beneficial for us. We also recognize that we have to do a lot of work with the mixed delivery system. The majority of our programs right now are in our LEAs, and many of them do not have space to continue to expand the program. So we're doing some very intentional efforts and outreach, visiting programs across our state to really talk about what it means to be in the mixed delivery system and have early child care programs. We're also doing a lot of work with the PDGB-5 world that we've been able to begin to continue to push the quality that we've experienced in first class pre-K down into birth through age 5. Our department is now implementing and overseeing the QRIS system. And that allows us to really make sure the same quality we've experienced in pre-K for many years can also be experienced through our quality rating improvement system for the state. So we anticipate being able to do some of the same types of efforts that we've done with first class pre-K in the birth to 5 world. Thank you, Dan.
Secretary Cooper, thank you so much, and congratulations on all that's happening in pre-K in Alabama. Incidentally, if you have not seen it, our friends at the Saul Zaentz Charitable Foundation put together a wonderful documentary here recently called Starting at Zero that focuses on the great success of the Alabama First Class Pre-K program. So if you've not had a chance to take a look at that, do Google it, and I know you'll appreciate seeing and hearing more about Secretary Cooper and the great work that's happening there in Alabama. With that, I want to transition on to South Carolina. Secretary Cooper was talking about the importance of a mixed delivery system. Georgia Miartin is the director of South Carolina First Steps to School Readiness, where they have been hosting a mixed delivery program for the state since 2006, actually founded as part of a court ruling in a school equity funding lawsuit that was filed by some rural school districts in South Carolina. But Georgia, this has been the year after, all these years now since 2006, the state has been sort of incrementally growing the program towards statewide, and under certainly your leadership and Governor McMaster's, this was the year that we saw First Steps 4K expand on a statewide basis. And also, I'll throw it in so you can just address both. An amazing innovation in South Carolina this year around subsidy supports for siblings of pre-K students. So please share a little bit about what's happening in South Carolina this year.
That's right. Thank you, Dan. Governor McMaster understood that for families to go back to work, for hardworking parents to be able to have the support that they needed to reemerge from COVID, and our state was early in reopening. Our childcare is never closed. Our First Steps 4K program, which is in private, nonprofit, faith-based, and charter schools, reopened last year, so June 1st, rather, of 2020. He realized that without that support for families, we were not going to be able to help people re-enter the workforce. And we were hearing, I remember I got a call from Boeing, a huge manufacturer here in South Carolina, from their director of HR, who said, how can we support our workforce in returning when they need childcare and they want high quality childcare for their children? And so we came together as a mixed delivery system and said, it's not enough to rely on the public subsidy and support for 4-year-olds. We also have to ensure that all of the siblings in that household also have access to high quality care. And as we know, oftentimes publicly funded pre-K systems are funded with different eligibility criteria and often different funding sources, in our case, state funding, different than the Child Care Development Block Grant. And so different sets of eligibility, different hurdles for entry, and for families, different application processes. So we worked together with our state's Child Care Block Grant recipient, the Department of Social Services, to streamline that process for families, to set aside presumptive eligibility for any family whose child was enrolled in the mixed mixed delivery 4K on the private childcare based side, which we call First Steps 4K. And through that, in the first year, the pilot year, which we're currently in, we have actually been able to increase enrollment in First Steps 4K. It's now statewide, as Dan said. We've been able to increase that enrollment by 33%. In no small part because of the geographic expansion to be a needs-based program that is statewide, but also to simultaneously enroll 26% of the families in the Plus Siblings voucher program. So we're seeing good uptake. We're learning a lot of lessons about how to work in an interagency, multi-funding stream environment, and we look forward to sharing some of those lessons learned and tips from the field later on in the hour.
Well, Georgia, so exciting. If there is another state that is offering subsidy to pre-K siblings, I'm not sure I'm familiar with it. So, an amazing innovation and just such progress in South Carolina. Congratulations on all that is happening there. And as just sort of a tip to our second hour. So Representative Senn and Dr. Blanford will be available in the child care room to have more conversation. Secretary Cooper and Georgia will be in the pre-K room. So if you have questions and want to hear more about what's happening in Alabama or in South Carolina, you may want to choose to go into that pre-K breakout discussion. Toward the beginning of the hour, as Helene was sort of going through the big wins that are outlined in the new 50-state progress report from the Alliance, governance obviously was a big topic. And so as we shift on to our third sort of umbrella topic, I want to bring Bill Jaeger from the Colorado Children's Campaign into the conversation. Bill, it's interesting, as we were putting together this panel, truly, and this is true not only of Colorado, but really of many of your states, we could have actually lumped you into childcare or into pre-K because there are so many great things that are happening. But boy, Colorado has had a very exciting 12 months here, sort of dating back even to last November. The state passed a statewide ballot initiative to create a new tax on tobacco and vaping products that will expand pre-K. Also legislative action, though, this year on governance, and will create for the first time an early childhood cabinet agency for the state of Colorado. So Bill, tell us a little bit about how that has played out and what you're seeing in Colorado.
Thanks, Dan. And I think the real downfall of being a panelist here is I can't go to our colleagues' breakout rooms. So much to learn. Wanted to pick up your point there and highlight that Colorado, like many states, and as Georgia even alluded to, really has been wrestling with this, sense that our early childhood system is bifurcated across the work of multiple state agencies. And so the people who have to navigate the fact that we have these multiple state agencies operating different elements of our early childhood system are overwhelmingly the parents or the providers or both. And that burden that falls creates significant issues in terms of equity of access and placing that child and family experience at the center. And so when under Governor Polis, who campaigned on increasing access to free full-day kindergarten and universal preschool, helped drive a push at the legislature at the tail end of the 2020 legislative session to refer Proposition EE to the ballot to ask the Colorado voters to fund universal part-day preschool for 4-year-olds. The Children's Campaign, in partnership with a whole number of partners, including Clayton Early Learning, Early Milestones Colorado, Council for Strong America, many of our state partners here, began to pull together conversations around what would universal preschool look like and how do we implement that effectively. And the overwhelming feedback that came back is if you add yet another funding stream without an intentional focus on the infant, toddler, birth to 5 impacts, and without an intentional focus on streamlining systems to place that child and family experience at the center, it's a real missed opportunity to reimagine the early care and education, and more broadly, the home visiting, family support, and healthy development of young children. And so that really became a push last legislative session where we had significant leadership from our state lawmakers, including Representative Emily Sirota, who has experience as a director in the early childhood sector, our Speaker of our House, Alec Garnett, our Senate President, Stephen Femberg, and an education advocate in Senate Janet Buckner came together and in partnership with the governor's office under Governor Polis helped push forward House Bill 1304, which reimagines the governance of early childhood in the state, elevates early childhood to a cabinet level position, and initiated a transition process that we have all been engaged in the state for 8-9 months now, and is coming to its conclusion in January, to identify what programs move, how they can work better together, and how to implement universal preschool. And so we have a series of recommendations that were the first round approved in November, the next round around pre-K in January. But we're really proud to take the lessons learned from other states that have gone down this road of governance reform and really to pick up the ball and think about, it's not just about how do we put programs together next to each other and remain siloed, but how do you look across and think across the child and family experience across programs? And so a lot of really exciting recommendations coming out. In just a moment, I'll drop a link to the first round of the transition report into the chat. But I think, many states should Build Back Better pass need to really kind of wrestle with this conversation around that child, family, and provider experience where children, 4-year-olds in a single preschool classroom might be funded by Head Start, childcare subsidy, state pre-K. And as one of our providers reminded us, they don't change their t-shirt for the part of the day that they're funded by a different funding stream. And it's our responsibility as state systems and policy advocates to make that system seamless. We're really proud of a number of other initiatives that we helped advance in partnership with a lot of people around maternal health, supporting family childcare homes, and those are outlined in the Alliance report, and happy to chat more in the breakout sessions about those.
Bill, thank you so much. I want to turn to Chris Jones now at the North Dakota Department of Human Services. Chris, like Colorado and New Mexico and a number of other states here, North Dakota is in the process of doing some consolidation of governance, and that's happening within your agency, the Department of Human Services. Not only incidentally, there are the early childhood services being consolidated there, but I know you're in the process of merging in health services into the department as well. So you've got plenty on your plate in terms of governance consolidation. And the state also, just in the past year, along with that early childhood governance consolidation, has launched its first ever 4-year-old pilot program as well. And as a connection, was modeled after first class pre-K in Alabama. So tell us a little bit about what's happening in North Dakota.
Sure. Thanks, Dan. I think, you sit back and you reflect on all these things, and, everybody who's, listening into this, I can unequivocally tell you, if it wasn't for the Aspen Institute and Ascend, which introduced us to Saul Zentz, which then introduced us to Alabama, which then I get to work with people like Georgia. So it just kind of feels like, and then you start to reflect, and it's like kind of one of those butterfly wings, events. But yeah, so the long story short, as it relates to what's happened in North Dakota, is we have done the consolidation of an early childhood division within the Department of Human Services. And I would tell you that that has gone marvelously well, mainly because we just ripped the Band-Aid off and we did it. And because we have a very good partnership between the Department of Human Services and the Department of Public Instruction. I can't emphasize enough that structure is just what you write on paper. It is not what you do from a leadership perspective, from building a culture. Empathy is so important, and Bill kind of emphasized this a little bit differently, but we have to stand in parent shoes. We have to stand in family shoes and understand how they can be successful. So regardless of whatever structure you put together, it won't make any difference unless you have the culture of serving kids and families. And even I would say it's big wins for little kids and families. I think Secretary Cooper talked about workforce. That's really where we're focused in on as we start to do this consolidation and start to build it up, and really using it as a launch pad for continued investment across the board as it relates to supporting our employers. And if you look at the workforce needs and the impact that those workforce needs have on families, and then you look at the downstream spend, the economics of investment in 0 to 5 becomes even more clear to those of us, which used to include me, that never understood the importance of investing in 0 to 5. So we have to continue to work together to share that story, not only from helping kids and families, but this is going to make America strong. And so even to the folks, I highly encourage you to watch that Starting at Zero, because that really, through Saul Zentz, really kicked off everything that we did. And Secretary Cooper, we talk about Alabama all the time. Do you know how hard it is to sit in the legislature and say, we're going to do the Alabama model? And for the most part, we picked it up, lifted it, and did it, and we still call it the Alabama model. Sometimes that helps us, sometimes it doesn't. So I highly encourage everyone on here to learn more about that, because they have the outcomes to prove it makes a difference. And that's really what we're leaning on. This is not to do it because it's even the right thing to do. We're doing it because it's going to give us a return, because no one can sell this better than the outcomes themselves. And so with that, we are also merging in the Department of Health and the Department of Human Services. And this isn't just about early childhood services education. It's home visiting, it's maternal health. It's everything that goes into creating a strong, stable family for the citizens in North Dakota. So thank you.
Chris, it's always so much fun to me to talk with you, because I think in every venue that we've ever had a chance to talk, you have made clear, as someone that I consider one of the great champions for early childhood right now, that wasn't always your position. What was it that sort of woke you up to the power of early childhood?
Yeah, it's always a hard story. I don't know if you're setting me up, but I my background is corporate healthcare, and one of my goals coming into government, this is my 5th year, was, how do I reduce the spend in the Department of Human Services? Where do you drive efficiency? Where do you drive effectiveness? And how do I make a difference for the taxpayers in North Dakota? The other nice thing about North Dakota is the executive director of the Department of Human Services gets to know children and families. And I had no idea. So with that, it just became even more important to do the work, because when you continue to grow as a human and you realize you didn't know what you didn't know, you have this self-reflection of like, how do I make the world a better place? How do I use my skills to make the world a better place? And oh, by the way, with early childhood, not only can you make the world a better place by being a good human and supporting families, you can also have a significant economic impact on the state that you serve. And so it's like the best thing to work on. I can't think of anything I'd rather do in the Department of Human Services than early childhood. And I have to be careful when I say that, because everybody's important, right? But if you want to be driven by outcomes, I can promise you there is enough data out there and information to suggest this is how you're going to make it better.
Chris, thank you for sharing. I'm glad I asked. So with that as a transition, I will again remind you that the third of our 4 breakout rooms will talk about governance, although you can tell from hearing from both Bill and Chris that both have lots of experience over the past year, really on all of these topics. So if you'd like to have more conversation with Chris and Bill, you can join the governance breakout room here during hour number 2. And that leads us then, Chris, was a good transition into kind of our 4th and final category of big wins. And those are in health. And I want to welcome Ted Lempert from Children Now into the conversation. But Ted, want to lift up some of the great progress that you are making in your work in California. You've been working in partnership with the state health agency there around, I know, social emotional health and embedding equity into that process. So give us an update from the West Coast.
Sure. Well, thank you, Dan. It's an honor to be with all of you. And thank you, Chris, as well. I think that was a tough act to follow. But I just want to let you know we're continuing our whole child anti-racist connector strategy here in California, working closely with core partners in the early childhood space, with thousands of groups through the Children's Movement of California, and of course our state and local officials on making some really big progress and some big wins. I just, in context though, similar to, like fellow panelists and colleagues here today, the pandemic has had a disproportionate impact on kids, especially families and young kids, especially kids of color, especially kids in poverty. And as I rattle off these wins and we talk more in breakout groups, I feel like a number of them have been long time in coming and overdue, and that the pandemic has helped expose really some of the inequities and the significant progress we have to make. And along those lines, we've touched on our families, our parents, and our providers who have been going through so much trauma of their own during this time. And with the staffing shortages we face in so many areas. So we're really mindful as we talk about these policy advances, making sure they've been done, really working hand in hand and recognizing just what's been going on in the ground throughout, our state in California and certainly the country. So I'm just going to mention 5 health wins, like a sentence or 2 each, just as a coming attraction for our breakout room, but also do want to note in the spirit of whole child that California made some significant progress this year in making a commitment to covering all 4-year-olds in preschool through our transitional kindergarten at the same time, and very importantly, making significant investments, not nearly enough, in childcare, because really the infant toddler had to go hand in hand with the expansion of our move towards universal preschool. So on the health side, as Dan mentioned, working close with our health department and others, we've launched a Enrich initiative and racial inequities in children's chronic diseases by 2030, a big audacious goal in focusing on pediatric asthma, childhood diabetes, youth depression, childhood dental carriers, and vaping related diseases, and really setting that big equity goal in terms of chronic diseases for our state. Another win was ensuring health coverage expansion of postpartum Medi-Cal from current 6 weeks to a full year, 12 months. Third, expanding trauma screenings to millions of more kids. As you guys know, California is a big state, so we talk in big numbers, but 5 million more kids are going to be eligible for now, eligible for trauma screenings based on the expansion to employer-based coverage. So through our Medi-Cal and employer-based coverage. Fourth, speaking of Medi-Cal, we're making a lot of progress. It's been so key in our Medicaid, Medi-Cal accountability and reform in terms of the managed care contracts. Kids are not getting the services, the screenings, and the access that they are entitled to. And part of that is really putting pressure on our department to make sure all the Medi-Cal managed care contracts, as we're redoing those in the next 2 years, are really focused on ensuring kids are getting the services they not only deserve, but are entitled to. And finally, in-home visiting, continuing to implement the win we got a couple of years ago with increased state funding, and really looking towards the future about how we can leverage Medicaid, Medi-Cal funding to dramatically expand evidence-based voluntary home visiting. So those are some of the key equity-based health progress we've made, and look forward to talking more in the breakout room.
Ted, thank you, and congratulations on all the great things that are happening this year in California. As we start to transition towards Stephanie, I am mindful that we're getting near the top of the hour, and so getting ready to start transitioning toward hour number 2. So for those of you who are viewing, want to encourage you to take a peek in the Q&A if you have not already, because in about 5 minutes, we'll be wrapping up the webinar portion of the program today, and we'll take about a 60-second pause, and then we will reopen those Zoom meeting rooms. And so if you have not had a chance already to grab the link that you're going to want to join into one of these 4 Zoom meeting rooms, please do take the opportunity to do that. My colleague Lauren Zabitsky has been dropping those into the chat, and I'm sure Lauren maybe can pop them in again here now, so that they're right near the near your fingertips here as we get started. And with that, Stephanie Spencer, I want to turn to you, and let's talk a little bit about Virginia. This year, the Commonwealth added 12 months of Medicaid postpartum coverage, added coverage for undocumented mothers, added funding for doulas. Tell us a little bit more about how this happened and what it's going to mean for the families that you're working with.
Sure. Thank you so much, Dan, for the warm welcome and the Hunt Institute for allowing us to be a part of this. I have been working in a community setting for over 27 years now. I'm a registered nurse by trade, so I get an opportunity to see a lot of things from all different perspectives. And so Virginia has really just taken the reins and run with health as a theme underneath of the Northam administration. So just to share a little bit about how this all really started was that the Northam administration really wanted to focus on maternal health as well as early childhood education. First Lady Pamela Northam had a heart for children in early childhood, and Governor Ralph Northam, who was a pediatrician, brought in health and health awareness in our state to try and strengthen that. And in 2017, really started to talk about the expansion of Medicaid as a key implementation strategy for Virginia. And in 2018, we actually passed Medicaid expansion, and in 2019 started to enroll families in expanded Medicaid. So it didn't, you didn't have to be pregnant or disabled to actually receive Medicaid. And since that has been rolled out, we have enrolled over 500,000 Virginians in our Medicaid programs. And this is extremely important because it sets the stage for what I'm moving into. In 2019, there was a maternal mortality bill signing. And basically at that time, Governor Ralph Northam said, I want to eliminate the racial disparity that exists in maternal health by 2025. And that basically pivoted everyone into actually focusing on how are we going to do this? And so there were some key themes that Virginia really took on, whether it be legislators, community-based organizations, state agencies, and the like. And that was that everyone is a part of the community. We didn't speak about the community because we are the community. The other thing was about collaboration, that we weren't going to be able to do this by ourselves in silos. And we took a village approach to change. And so after 2019, Governor Ralph Northam and his administration hit the ground. A lot of us went aboard with him, and we conducted 10 listening sessions across the state of Virginia, because what we knew was that the community had the answers to what needed to occur next. Just as Urban Baby Beginnings was built by the community, our strategic plan in Virginia was built by Virginia community as well, and enhanced by organizations and state organizations and propelled by legislators. So he completed that 10-session listening tour, brought in over 100 stakeholders, and we started to work on a strategic plan, which was actually launched in, I want to say in April of 2019, 2020 or so. And what that did was it outlined all of the areas that we needed to focus on. And there were three key areas that popped up. One was 12 months of postpartum coverage. The other was doula support. One was increasing health access. So I'll talk a little bit about that briefly. Our undocumented pregnant folks now have access as of July to full Medicaid coverage for pregnancy up to 12 months postpartum. We have a doula benefit, which will cover 4 prenatal visits, 4 postpartum visits, and the birth for doulas in the state of Virginia who will become state certified and Medicaid doula practitioners. And we're looking to see that actually expand and be launched in this summer. Our 12 months of postpartum coverage, we just actually had a visit from Secretary Becerra in Virginia and CMS Administrators Chiquita Brooks LaSure to announce that we are one of, I believe now, 4 states that has actually expanded 12 months postpartum coverage. And what that means for us is that with this expansion, as opposed to Urban Baby having to pull volunteers, as opposed to hospital systems having to have charity care, we can now pivot our focus on being able to create and expand community-based systems that provide wraparound services and support to community members, and also that we focus on health and wellness as a whole and a lifelong approach. I want to end my conversation with saying, and I'm using a quote from one of the folks that was on our maternal listening tour, and she said there needs to be more M in maternal. So in perinatal health, though we do talk about early childhood education and we understand that's important, it starts with the birthing person. And that's what we want to get across today in Virginia. So look forward to seeing you all in our breakout session.
Stephanie, thank you so much. And it's incredible that we had I think 9 panelists that we planned to talk to in the hour, and that we at 3:01 managed to wrap up in the way that we did. Thanks to all of you for taking the time to do this. And in just a moment, we are going to transition into our interactive hour 2. Want to lay a couple of ground rules for the second hour, just to make sure that this runs smoothly. First, I would ask, take a look. Lauren has been dropping into the chat the 4 different rooms. So in childcare, we'll be talking with Representative Sen, Dr. Blanford, about the Fair Start for Kids Act in Washington. In the pre-K room, Dr. Cooper and Georgia will be there to talk about the pre-K wins in their state. Bill and Chris will be talking about governance and any of a number of other things happening in those states in the governance room, and then Ted and Stephanie in the health room. As you choose which of those rooms to go into, we'd ask you to do a couple of things. First off, turn on your camera. We would really love, it's even if you don't anticipate asking a question in person, it's just nice to be able to see your smiling face and know that we're talking to real people and not to little black boxes on the Zoom screen. So definitely invite you to turn on your camera. As you enter those rooms, though, we would ask that you make sure you mute your microphone. We could have in some of these groups a bit larger Zoom meeting group than a traditional Zoom meeting, and so we're going to do our best to sort of manage the chaos a little bit. If you can mute, and then your moderators in the room will call on you. There's a couple different ways. You can use your little Zoom hand to raise your hand and show that you have a question, and wait for the moderator to call on you. Or if you want to put questions into the chat, if you'd prefer the staff that are there moderating ask those questions, then you can do that as well. So as we're taking this last moment to take a look at those, I'm going to screen share just one moment of coming attractions for 2022. You know that we do this each month, and let's see if I can get this to start. We do this each month. So looking into 2022, very excited by some upcoming programs, and we hope that you'll take a moment to register. Beginning on Thursday, January 6th, right after we get back from the new year, we will be talking about the First 10 model, and we'll be talking with David Jacobson, who is the director of First 10. First 10 is an amazing model that helps to coordinate and strengthen partnerships between school districts and community-based early childhood providers, particularly as we're looking ahead toward the implications potentially of Build Back Better. This will be an awfully important topic for districts and communities, so we invite you to register, and a fantastic panel there on January 6th. Another very pertinent kind of Build Back Better topic on Tuesday, February the 1st. You may know that in childcare, Build Back Better is envisioning that states will go through a cost modeling process and replacing their current subsidy rate setting with a study that looks at the real costs of quality to include a living wage for all staff. Luckily for us, the state of New Mexico has recently gone through a similar cost modeling process. In early February, we'll be joined by Secretary Gruginski, who leads the New Mexico Early Childhood Education and Care Department, along with Gina Capito and Simon Workman of Prenatal to 5 Fiscal Strategies, to talk a little bit about the cost modeling process that New Mexico has used to help to realign their state subsidy payments on the basis of quality. And then last but certainly not least, excited to look ahead into March, and this is where you got a real insider tip here. In March, we will be joined by Dr. Dana Suskind of the TMW Center. You may know Dr. Suskind wrote the best-selling book 30 Million Words, and has a new book coming out in April called Parent Nation. We're going to focus on that release. We'll be talking with Dr. Suskind and with Yoli Flores of the TMW Center. And here's the exciting part, which is that for the first 500 registrants for that program, you will receive a free copy of Dr. Suskind's forthcoming book. Not until April, obviously, when it is released, but we'll be keeping track of who the first 500 to register are. The books are already going quickly, so I would tell you, if you'd like a free copy of Parent Nation when it is released in April, this would be a great time for you to go ahead and register for that March Early Efforts webinar on creating a Parent Nation. So with that, I will stop screen sharing, and I think we're going to get ready to transition into our breakout rooms. Hopefully everybody had an opportunity to take a look at the chat. I will, for the benefit of those who are going to the governance room with Chris and Bill, I will be there. I'm going to keep the webinar going for just maybe 60 more seconds. So anybody who needs to grab that link still has it, and that we won't have closed that. But we invite you at this point to go directly. You can log out of the webinar and into your Zoom room, and we will see you there in about 60 seconds. Thanks, everyone.
Thanks, Dan.